Hello, my name is Makayla Flores, and I did my internship this summer with Rock and Armor Physical Therapy. I did a research paper for my project based off of the significance of dry needling for headaches or migraines. And with this research paper, my aim was to learn more about what dry needling is, its benefits, risks, its potential use for the future in the field of physical therapy, as well as its future use for my future career path. Beyond that, I learned a lot from doing this research for this project. I learned how dry needling is done, which is they stick a needle through your skin, usually trying to find a trigger point, which is like a knotted area in your muscle that can cause pain or referred pain, kind of like tension type headache, pain to your head. They might use 1 to 2 needles or several, and it could last a few seconds, or they might leave the needles in there for longer, like several minutes. When they do the needling, there's superficial and deep dry needling. Superficial goes just to right above the muscle where that trigger point is, while deep dry needling goes directly into the muscle, into that trigger point, which is what I saw most therapists performing at Rock and Armor Physical Therapy. They also added electrical stimulation. Without the electrical stimulation, the idea is to elicit a kind of muscle twitch response, which is a good sign that the muscle is reacting to the treatment. Sometimes using the electricity just kind of intensifies that, and it can make it repeat more of the twitching. Dry needling can treat other conditions besides headaches and migraines, such as joint issues or even like pelvic pain. There are certain situations where you wouldn't want to use dry needling, such as if the patient is pregnant or has a compromised immune system. Getting into the benefits, specifically for headaches and migraines, dry needling has been found to help reduce the frequency, the intensity, as well as duration of headaches and or migraines. And then risks for dry needling in general are relatively low, which is good, and it's not as invasive as other treatments might be. You might come off the table feeling a little stiff, a little sore where they needled you. There might be some bleeding, there's a chance of infection, and if they're dry needling you in your thorax area, so anywhere around your ribs, there is a chance for collapsed lung just from puncturing into that area. One thing I found really interesting in my research was that dry needling is as effective as other headache relief treatments, and it also went into how dry needling is not illegal in the United States in general, but there are certain states that don't let PTs dry needle, such as Hawaii or New York. My biggest takeaway from this project and from this research was probably that there's still limited research about the effectiveness of dry needling for headaches and migraines. So there definitely needs to be more research done to better understand the effectiveness and future use of dry needling for migraines and headaches. If I were to do this project all over again, I would say that I would take maybe a poll of other patients in the clinic's responses, subjective responses to how effective they felt dry needling was, just to even get a more personal experience with patients there, as well as see, like with other conditions, how dry needling was helpful for them or maybe not so much. I think that would have been helpful just to get a better idea of that. While at the clinics, a typical day was a 4-hour shift, taking patients through exercises prescribed by physical therapists, shadowing the physical therapists. When I wasn't doing that, we were usually cleaning keeping the treatment and gym areas clean, so flipping tables, restocking, putting equipment back where it belongs. We would also help set up and take off modalities for patients, so that would be hot packs or ice packs, Coreflex, which is a shoulder compression device, some compression boots, as well as a game ready machine and electrical stimulation, which we used in a few different ways. Going forward, beyond this internship, I did really enjoy the environment of a more active population going through physical therapy, as I've had experience with geriatric patients. So it's interesting to see that side of things. So going forward, I can see myself in this career as a physical therapist, and I think I plan to pursue this career further, growing and learning about the inner workings of it all, and maybe someday getting to perform dry needling for somebody else. Thank you for watching my presentation.